Okay, so it is me. I'm going to just quickly give you an overview of the exercises we did today. Just feel free to use these before bed or anytime you just want a more gentle practice, especially if you're feeling that low back hip tension. So what we're going to start with is you'll go ahead and we had started with the hip adjustments with the wedges. So I just want to show you in lieu of the wedges, what you can do is just get like hand towels. You can stack 2 hand towels together and just roll them up end to end. So fold them in half and roll them up end to end. And you should have a bolster that's enough of a width and enough firmness that you can just readjust. I will also show you something that you can do in lieu of that. But wherever you're feeling, it probably will be consistently the left hip. Usually it's one or the other. So if you'll just check in with the hips, you can look in front of a mirror and just make a little L shape and just check on the top of the hips, and you can see if one is sort of hiked up more than the other. If that's the case, then that means that the ilium, the hip bone itself, is rotated forward, and so you'll need to put, whatever one is forward, you'll need to put mid-thigh there. So whichever one is like hiked up, you'll have to put mid-thigh, and the other one that's like just kind of normal, you'll just put right up on the hip. That will anchor everything that's good there and kind of create some biofeedback across the whole pelvic structure. So you'll start prone like that, and just breathe into that, and then just allow weight and everything to settle. You might feel some shifts in the sacrum itself, in the low back. And then from there, you can come back to the child's pose. And then if you want to feel a stretch across the low back, you'll just bring the knees together. And if you want to feel a little bit more in the hips, bring the knees apart. And take a few breaths here, and then you'll come up into a tabletop position. And here's where we'll just start to work with that deep core engagement. So you'll go ahead and just move into first cat-cow. And then as you're working into that cat pose, really engage in the deep low core and press firmly through the hands and the knees. So here we're starting to get a sense of that deep core engagement, the kind of bringing the energy in to kind of create a stable foundation for the hips, for the pelvis. So you'll do a few rounds of cat and cow, and just be sure to accentuate that deep core engagement here at the end of cat. And then you're going to settle into a neutral tabletop, and then you're going to ground through opposite knee and hand. So I'm going to reach out through the left foot. So first I'm going to start with the foot. And then here, alignment-wise, you're wanting the hips to be mostly square to the floor. So you might bring the knee that you're balancing on more towards the midline, and then feel free to pad the knee as well if you want to grab a blanket or something. Remember that the toes are activated and spread. Then shift your weight onto the knee that you're resting on, and the opposite hand you're going to reach. And then you're just going to engage, pull in deep engagement to knee and elbow. So you might even feel in the hip as you bring the knee closer to the chest and tuck towards the elbow. You're just intending this cross-body motion. They don't necessarily have to connect. You're just wanting to feel that cross-body deep core engagement. You might do 5 of these or 6 of these. We're just trying to get everything awake from the back of the body all the way into the deep core. You'll rest here. Maybe you'll do a child's pose. Maybe you'll kind of shake the wrists out, and then you'll do the other side. 5 to 7, I guess, here. So inhaling, reaching out, exhaling, knee to elbow. And again, it's really about that deep core stabilization and feeling that you're being, sort of held from that space. And then you can kind of shake it out. Do whatever you need to do here. And then from here, I believe we just went straight into that deer pose situation. I'm trying to think if that's exactly what happened. Yeah. So you'll come into deer pose and then it's going to be, seated this way. So I'm going to take a quick pause here and show you this. Just to keep it in mind, if you're here and you're feeling crunchiness on the side where the sits bone is down, you can grab a bolster or a blanket and lift up that left. So if your left is in front, then your sits bone is down. And you'll just put that sits bone on top of a bolster or blanket. If you're feeling like things are kind of crunchy in the side body and in the front, you may not need that, just as an aside. And then as a precursor to this, if you are not going to be using the hand towels, bolsters for the hip realignment, you can do that here in this pose. So from here, you'll just start to work with the cat-cow motions again, but just focusing on anterior, posterior tilt of the pelvis, right? So these are the hip bones, they're kind of going forwards and backwards because you're working with that. And then remember too, when you're kind of rounding out, just engage deeply. So you can even take the tail end of your shirt and kind of wrap it around to give you that biofeedback in terms of having a sense of tension across the lower abdomen to just support the low back. So you're just going to be doing this kind of rocking motion, maybe 12 times or so. And again, this is in lieu of like just using the bolsters to get the hips realigned. This way you can in the same way. So then from there, you're going to take that hand down, and then you're going to be just rotating this, this hip, this femur all the way. So most of the weight's going to be in the hand, and you're just going to be rotating the femur, all the way down. And you can, if you like, just kind of give it an extra little tug with your hand to just facilitate a full rotation. What this does is it creates some biofeedback to kind of take the head of the femur a little bit more out of the acetabulum, because when the hips are kind of rotated and cocked, the femur just gets jammed up into the acetabulum of the hip, and that's what causes that kind of hip jankiness. So what we're doing is we're just telling our bodies like, hey, femur and hip bone, y'all are separate entities, like let's reset. So with this one, it's the same thing, maybe about 12, sort of rotations, just allow your breath to be soft, work rhythmically. You might feel some opening in the front of the hip here as you do this. And then of course, you never want to go into any pain. So if you feel any kind of discomfort, stop, make any adjustments you might need to bolsters or your arrangement of your legs. So now as we're here, we can kind of start to move into this space, right? So hands across over, and this is sort of like a modified pigeon pose. So you'll be here, first you'll kind of extend up as if you're going to go down into a pigeon pose, but we're coming to the side, and then you're going to come down to the forearms. Rest in the forearms for a bit. And it's really up to you. And then remember that you have that trick as well of pressing the legs into the earth. So pressing the shin into the earth and then that other leg, and you'll start to feel some engagement here in the adductors. And that's just a little bit of a strengthening, stabilizing thing. So we're here for a bit, and then you're going to start with this rotation. So you take that forearm of the left hand and then just turn it parallel. So we got like this sideline, pin-up girl situation. I mean, I'm into it. It feels good for me. And you're just going to start to reach forwards and backwards. So you're going to reach across, rotate the torso towards the ground, reach across, and then you're going to feel that connection, that tensile connection between the fingers all the way down into the low back area. And then you're going to press into that forearm here, rotate open to the sky. So we're just rotating and creating a little dynamic twist with the torso. And you can also adjust this leg if you want to bring it back to feel more sensation that way, or if you want to bring it closer to the chest. So for me, I feel quite a lot more sensation if I just take my foot back, so I'm doing that. So I'm going to do this, right? Maybe 12 or so, just feel it out, what feels good. You can even linger in a stretch for a minute, breathe into that, straighten the leg. Really make this practice your own. We're gonna come back up this way, straighten the legs, wiggle. Maybe notice any differences or changes from side to side. And then we're gonna come back this way, the other way. So again, I'm just gonna offer this too. If your sits bone is down, if you're feeling any compression, you can just lift up with a blanket or a bolster underneath just that right sits bone, okay? So that you have like a bit of a shelf here. And then from here, you're going to anterior, posteriorly, like tilt the pelvis. So that cat-cow motion, but you're seated. Feel free to rearrange and adjust as needed if you're feeling any tension on the knees or joints in any way. Maybe 12 of these, right? Just kind of getting that rocking, kind of rhythmic anterior, posterior tilt, just talking to the pelvis and being like, hello, pelvis. You are separate from the femur. You're separate from this femur. Did you know? Right. And then from here, we're just going to come onto that right hand and then be like, hello, femur. Did you know that you're separate from the pelvis? And then this is a motion where you're just rotating that hip forward, right? So your weight is really like in this right sits bone. And you're just kind of rotating a little bit to kind of, this is a precursor, right, before we get down into the forearms. So you're just kind of opening it up. You might feel a little tug sort of in the adductors and then also in the front of the hip flexor. So we're going to do that for 12 or so. And then we're going to come forearms down. Just breathing into this space. And then again, you can adjust the leg as needed. And then after, I would say 5 or 6 breaths here, or whatever feels good, then you're gonna take that forearm, take it parallel, and then you're gonna just start to rotate open. And rotate closed. So rotate, pressing the forearm into the mat and bringing the chest to face the ceiling, and then rotating down, chest to face the earth, like so. And then again, as needed, you know, you can adjust that leg if you want to feel like cross body stretching all the way throughout, whatever sensation is going to feel good for you. And then play with tempo, play with faster or slower. If you're moving faster, it's going to kind of give you a little bit more energy. It's going to ramp up your sympathetic nervous system. If you slow down, it's going to help kind of put the brakes on a little bit. All right, now we're going to come up. Cool, so we did that. Everything's all twisty. Straight. And then now, let's see, what else do we do? I believe, yeah, then we did, so as you're supine, when you come to supine, you might have like a bolster or just a rolled up blanket. So I'm just gonna remind you that you'll want that for your low back when you're supine. So, and then when you have that blanket, just remember that you can use this in a couple of different ways. When you roll it up end to end, feel free to adjust as needed. And then from here, we work with shoulder rotation of motion. So you're gonna flip the palms face up, and then you're just gonna start with the snow angel action. And then keep the elbows bent as needed, and just honor the range of motion by their shoulders. So if you're not easily able to get into a range of motion without pain or discomfort, then just stop at your natural end of range of motion. Like there's no need to push. We're just noticing what's there and moving gently into that range. So you might do this, 7 or 8 times just to kind of get the shoulders awake and ready. And then we'll move into the somatic practice. So goalpost arms, and then you're just going to inhale, look to the right, flip the palm up, flip the right palm up and the left palm down. And then you can move in sort of, I like to move in a bit more of a fluid way because and keep my eyes open, tracking across the ceiling, because that helps me, you know, if I take pauses, especially with a somatic movement, I can kind of get stuck, and lose the thread of the movement, plus the eye tracking, because with a somatic movement, it's doing a couple of things. We're not only engaging the nervous system, and the somatic experience of what's going on in the neck and shoulder complex, but we're also like keying into our sense of interoception and, you know, the complex movements that happen when you're working with neck and shoulders in this way. So eventually, as we kind of move more fluidly with this and allow the hands to land wherever they land, we might find that our range of motion is increased because we are sort of loosened our grip somatically on what's going on neck and shoulder wise. Do that for a few rounds. And then you'll just rest and integrate. And I believe that's all. There's the last thing is, I remember now, it's gonna be the supine twist. So you're gonna cross ankle over knee and just wiggle it, wiggle. And then as you're ready, left knee goes to the side, supine twist, and then flip, supine twist. And that's the last thing. Okay, well, if that helps, see you next time.